Good afternoon, everyone. Welcome to the H3D Foundation webinar series. Our today's speaker is Dr. Thaddeus Grasela. Dr. Grasela is working as Managing Director at the Azimuth Global Health Consulting. He is a scientist, entrepreneur, author, and systems architect. His current focus is on the application of emerging tools in knowledge management and artificial intelligence to work constructively with the complexity inherent in global health and development challenges. He has authored or co-authored more than 100 peer-reviewed publications and book chapters. In 2013, Dr. Grasela was awarded the Gary Neal Prize for Innovation in Drug Development from the American Society for Clinical Pharmacology and Therapeutics. Today's topic for webinar is Velocity Made Good, the pursuit of getting better at getting better. Before we start with the webinar, I would like to let you all know that we'll have a Q&A session after the talk. So you can either post your questions in the chat or you can ask it at the end of the talk. Now, I would like to request Dr. Grasela to share his work with us. Over to you, Dr. Grasela.
Thank you very much, Rudy. I appreciate I'm getting feedback. Can you do something about that?
What happened, Dr. Grasela? I can see the screen.
When I speak, I was getting feedback, but it seems to be better now. Okay, sorry. Okay, so thanks very much, Rudy, and everyone. I appreciate the opportunity to talk with you today. As Rudy mentioned, my background is in clinical pharmacology and also epidemiology. And when I was first starting in my career, I was really interested in modeling and simulation of pharmacokinetics and pharmacodynamics. And I started a company that became Cognigen, and we were providing clinical pharmacology consulting services to pharmaceutical companies. About 10 years ago, Cognigen was acquired by Simulations Plus, and you may know that company as the one that licenses GastroPlus and other software for performing simulations in drug discovery and development. And around that time, Steve Kern from the Bill and Melinda Gates Foundation called and asked if I would be interested in working in global health. So I started consulting with the Healthy Birth, Growth, and Development Initiative within the foundation. And it was during that time that I learned a lot about the real complexity behind the challenges in global health. And what I would like to do today is to share with you some of the lessons that I've learned in how to better deal with that complexity. And hopefully you'll find that it's relevant to your work at the H3D Institute. I also want to mention that I've started to write essays on the Substack platform that dive into some of the details of the topics that I'm going to be talking about here today. So I would really welcome if you would subscribe to that Substack. It's for free. But there's a series of essays there that, again, describe in detail some of the topics we're going to talk about here today. So I came to the idea of titling this presentation Velocity Made Good from some of the experiences that I've had racing sailboats. So if you've ever been on a sailboat, you know that it can't sail directly into the wind. So you're always sailing at an angle to the wind. And the closer you're able to sail to the direction of the wind, the better your velocity made good. So velocity made good is the magnitude of the speed vector pointed in the direction of the wind. So if you fall off from the wind and sail at an inopportune angle, your velocity made good won't be very good. And I think that this is an apt metaphor for our work as scientists, regardless of whether you work in global health, drug development, or if you're a regulatory reviewer considering a dossier for market authorization. And the question is, how do we get better at avoiding missed opportunities and wasting time and energy on research projects or solutions that aren't optimal to the setting that we're in? And what we're going to explore here today are what are ways that we could be getting better at our work as scientists. So there are 4 key ideas that I would like for you to keep in mind as we go through this presentation. That the challenges in global health are incredibly complex and they have multiple interacting risk factors. That there are ways of working constructively with this complexity and involves coupling innovative thinking with new tools and knowledge management processes that are emerging. These tools and processes can expand our awareness of the context of challenges and subsequently help guide our actions. But this will only work to the extent that we cultivate our ability to tolerate ambiguity and uncertainty that accompanies an immersion into complexity. And unfortunately, in global health, we can't escape this complexity. So this conceptual scheme is a picture that was generated by Sarah Jensen and her colleagues that describe the risk factors and interrelationships of risk factors that affect brain structure and cognitive functioning in the brains of small children. And so any research that you might want to do to find ways of preventing impaired neurocognitive function has to take into account all of these different risk factors. And so our thesis, building off of this complexity, is that any attempt at accelerating innovation, whether it's a drug or a policy, requires that you have a deep understanding of the complexity that surrounds the problem you're trying to address. And over the last several years, my colleagues and I have been pursuing a number of different hypotheses to try to understand what it means to understand complexity. So we believe that by systematically scanning, curating, and synthesizing knowledge by multidisciplinary teams across disciplines will provide unique insights into complexity. The conceptual schemes, similar to this one, that you construct from this process can be leveraged across the research and development and regulatory review lifecycle and have an important impact on product labeling, the way that we do real-world data analysis. They can serve as heuristics for large language models and would improve our efforts at causal inferences. And as we'll see, these conceptual schemes serve to enrich a question-based review process that will provide a deeper understanding of salient differences across global context. So one aspect of the Healthy Birth, Growth, and Development program was to begin to assemble all of the different factors that were relevant to healthy birth, growth, and development. And this is a snapshot of the knowledge graph that was assembled by that team that explores the relationships between a variety of different factors, processes, and interventions across different timescales and different biological, social, geographic, and economic foci. And as we've been envisioning it, we think that these graphs can be used by a variety of individual scientists, governmental agencies, policymakers, and so forth to immerse themselves in the complexity of a challenge and to develop better ways of visualizing the different dimensions that we have to pay attention to solve a problem, identify gaps, design studies to address those gaps, and then develop theories that we can use to guide the development of action plans. Now, importantly, the community-based process for developing these graphs will establish communication pathways between entities like global regulatory authorities and facilitate knowledge sharing and enrich the conceptual schemes we use as part of our work. Now, you might look at this and say, I don't understand how I can use this cloud to understand complexity. Well, we can take a clue from our ancestors, right, who looked up at the sky at night and wondered about the mass of stars that they could see lighting up the night sky. And what they did was to start identifying patterns, or at least patterns that they thought they could see. And they called those patterns by different names, for example, the Southern Cross, and recognized that those patterns were helpful in identifying objects in the sky and setting direction and so forth. And we've had the luxury now of new technology that our ancient human ancestors did not have. And so we've been able to explore the regions around these constellations and find, for example, and understand and explain things like the Coalsack cloud that obscures the light from the Milky Way stars in the background, or lets us see the beauty of the jewel box that is the open star cluster in the region of the Southern Cross. So that process of looking at a cloud of information, a knowledge graph, and trying to make sense of it is something, that process of knowledge synthesis is something that we've been working on quite a bit over the last few years. And we've been using some of the tools that are emerging now for knowledge management and communicating with multidisciplinary teams virtually to explore these, to create these graphs and explore them for their gaps in insight and the development of action plans. So we're developing these processes that would enable a systematic collection and curation of all of the published data, as well as great literature. Great literature are things like emails and conversations that we have with one another that don't necessarily make it into the published realm, but are really important in gaining insights into particular problems. We can use that graph to generate conceptual schemes. We can vet those schemes with different individuals from different disciplines and adjudicate any conflicting ideas. And then we can use those to support a question-based review of processes and help in the analysis and interpretation of the data that comes from the real world. And then by integrating these schemes across different disciplines, we can realize a potential that isn't really apparent if we're only working in a single discipline. And as we continue to iterate on this process, we can continue to improve that knowledge synthesis process and its efficiency. Now, I believe that all of us have a superpower of some sort. In our work in science, one superpower might be the ability to herd cats, to get a group of scientists from different disciplines to work together and accomplish a goal. A superpower might be your ability to make connections between ideas that other people see as just simply disparate and not really very interesting. But because of your ability to see those connections, you come up with novel solutions that others have missed. Well, we call that superpower in science holiteracy, and it has two components to it. One is an innate ability that one must have to be comfortable with the ambiguity and uncertainty that arises when you look at that knowledge graph I just showed previously. And the second component is a cultivated skill where you are able to synthesize parts and wholes from different disciplines and recognize the new possibilities created by those interconnections. It's that skill of holiteracy that allows us to do a better job of risk assessment and identifying gaps and irregularities in the theories that we have, and develop better conceptual frames, and then performing modeling and simulation that help us to predict the outcomes of our actions. Holiteracy entails striving to learn as much as possible about context and to act constructively in light of that evolving understanding. And importantly, it only sometimes makes the design of an action plan more accessible. But what it does do is to hopefully prevent selecting the worst options. And I think we could all come up with examples of top-down solutions that weren't really very good solutions and resulted in unintended consequences. So we've been using this skill of holiteracy and encouraging it, fostering it, in the application of developing action plans for global health research, helping to design processes for complicated activities like institutional review board protocol reviews, for engaging in revisiting policy reviews, and for implementing a concept called regulatory complementarity that I'll talk about in one moment. So I'd like to talk about actually the application of these ideas in the regulatory review process for achieving or securing market authorization. And it's a really great example of the importance of context in science-based decision-making. Now, drug regulatory authorities pursue their review of a dossier in dynamic environments. There's social factors, political factors, economic factors, and natural environments that have to be considered. And even in high-income countries, the reviewers have limited resources. They can't chase every question they have. They have bounded information, which I'll explain about in a moment. And they have to be mindful that the benefits and harms of a specific innovation, a drug or a policy, can vary across different individuals, populations, and contexts. And we're trying to minimize the harm and maximize the benefit in those contexts. So this rather complicated slide is an attempt to try to explain the importance of context in pharmaceutical research and development and regulatory review. So as we learn about the clinical pharmacology of potential new drug in discovery and early development, we develop conceptual schemes that explain that pharmacology and attempt to explain how the drug works and how toxicity can arise. We use those schemes in a dialogue with regulatory agencies, clinicians, and patient advocates to design studies that can optimize the potential for a positive outcome of the trials. And so we carefully select our patients for trials that constitute the primary evidence of new drug performance. The subsequent regulatory reviews of the submitted dossier depend heavily on that context-dependent performance of a drug. Now, the reviewers have to consider what happens in different contexts. And so they perform a review and ask questions about how different intrinsic and extrinsic factors can affect outcomes. And they try to take those contextual implications into consideration in the regulatory review process and the production of the final product label. In the current scenario, that product label is then handed over to regulatory reviewers in low-income countries, and they use a process that's called regulatory reliance to borrow that information and to extrapolate from it as best they can to the local context to write local product labeling. Now, we've become very good at dealing with the intrinsic and extrinsic factors that can affect pharmacokinetics and pharmacodynamics. So we know, for example, that we can do a variety of phase 1 studies that speak to the effects of age and gender and so forth on pharmacokinetics. And in some cases, we can even use physiologically based pharmacokinetic modeling platforms to predict the effects of these factors on drug absorption or to predict drug-drug interactions. Sometimes we insist that pharma companies perform large-scale clinical trials in different contexts to make sure that the drug actually works and doesn't have unintended consequences. Or if the situation is such that we just can't figure out what to do, we might decline market authorization. Well, the problem is that as we think about the global ecosystem for drug use and regulatory review, the context that a drug can be used in are quite significant. And we have to try to disentangle their effects if we're going to properly label a drug. So one of the ways that we could do that is to leverage some of the ideas that we've been talking about here in terms of exploring the context of different challenges and using that information to formulate better theories and understand gaps and insights. This is a conceptual scheme of some hypothesized pathways for environmental enteric dysfunction. This is a problem with the gastrointestinal tract that is common in countries where water, sanitation, and hygiene aren't as good as they should be. And it results in inflammation and structural changes in the gastrointestinal tract that affect enterocyte tight junction functions, affect intestinal permeability, drug absorption, microbial translocation, and mucosal inflammation. So one of the issues here would be, can we use this conceptual scheme as a basis for exploring these different effects of enteric dysfunction to understand more about how these features actually affect their impact on physiology and pharmacology? How does that affect drug absorption? Can we use this information to develop better product labeling for drugs in different populations? And how does this affect the efficacy and safety of a product in different populations? So instead of the process of regulatory reliance that we described before, we have been promoting this concept of regulatory complementarity. So the drug development process proceeds as it did before, but during the regulatory review, instead of a sequential handoff between high-income regulators and low-income regulators, we foresee a collaborative question-based review that draws on the greater diversity of intrinsic and extrinsic factors that are found in low and middle-income countries, like the problem of environmental enteric dysfunction, to engage in a collaborative question-based review process that expands the context in which we're asking questions about drug safety and efficacy. If we were to implement this process of complementarity, we would strengthen the knowledge base, the communication infrastructure, and the talent pool between regulatory agencies in high-income countries and low-income countries. And we would create opportunities to expand the scope of engagement with regulators across these contexts. It would broaden and accelerate the adoption of regulatory reliance, which is in line with WHO's current goal for that policy. And it would help to increase global regulatory efficiency and accuracy and help to accelerate global access to quality assured, safe, and effective medicines. Now, this process of knowledge synthesis that we've been describing and trying to achieve maximum velocity made good is relevant not only to drug development, but also to the challenges that we face in meeting the Sustainable Development Goals. And of course, the reason why achieving these goals is so difficult is because the complicated interconnections between these goals. And there are a variety of very dynamic factors that affect how these problems play out within individuals, local communities, nations, and across the globe. And so this brings us back to our thesis. If we want to accelerate innovation and achieving these sustainable development goals, we have to spend more time and energy to understand the context behind all of these, behind the complexity of these goals. We have the opportunity, by understanding complexity and the sources of context. Excuse me for just a moment. Apologies, the house is waking up. If we were to deploy some of the ideas that we're talking about here today, the advantage I hold out for you is the possibility of seeing old problems that we thought were intractable with new eyes. Where we are right now is we become really good at working out our data standards. We know how to automate workflows in drug discovery and drug development. We're designing better and more powerful instruments to tell us about the complexity that we have to work with and how pervasive it is. We're recognizing the value of multidisciplinary collaboration, and we're beginning to see the potential and pitfalls of artificial intelligence and large language models. But if we're going to take advantage of all of those capabilities, then we're going to need to commit to using the tools and processes for community-based knowledge synthesis that has the potential to generate new theories and take us to new levels of understanding. This picture that I'm showing was taken by Voyager 1, the space probe that was launched, I don't know how many years ago. But the picture was taken from 6 billion kilometers of Earth. Carl Sagan was able to convince Mission Control for Voyager to turn the cameras around and take a picture of Earth. And I think you'd agree that it gives us a really different perspective on our situation by looking at the problem from that distance and recognizing the responsibility that we have for dealing with global problems that we have and understanding them and coming up with innovation. So thank you very much for your attention during this presentation. I would be very happy to answer any questions that you might have. And one of the things that made me interested in actually giving this presentation is that I was wondering how, in the face of the multidisciplinary context that you have there at the Institute, how do you think about the complexity that the complexity of the problems that you deal with, and how do you think about managing that complexity and building coherence across the programs that you have? And I think this would give us a good basis for thinking about the implications of what I've been talking about here today. So thank you.